Oh, healthcare. What are we going to do about this healthcare plan? You know, the Congressional Budget Office, which is nonpartisan, today released a report that said this new healthcare plan is not going to stop the trajectory of healthcare spending, that it's going to continue to spiral out of control. The director of the Congressional Budget Office, Douglas Elmendorf, stood before the Senate and said this is not going to work. It's not going to delay. Here, looking at the news story, he said, in the legislation that has been reported, we do not see the sort of fundamental changes. Isn't that what Obama said he wanted to bring, fundamental changes? We do not see the sort of fundamental changes that would be necessary to reduce the trajectory of federal health spending by a significant amount. On the contrary, the legislation significantly expands the federal responsibility for health care costs. Now, that obviously is not going to set well with Nancy Pelosi and with Harry Reid in the Senate. But here's the thing. Think about this logically for a minute. Let's just think about this logically for a minute. When was the last time Congress did anything that stayed within the budget? Take Social Security, take Medicare, take Medicaid, all of these programs that were originally supposed to start out as this, and they all burgeoned into this. Why? Because the government loves to get their fingers in our lives financially so that they can control us. So this health care bill, they're already starting to talk about 57% of income going to taxes in New York State to help pay for medical care. A 5.4% surcharge on those who make $350,000 or more. Well, you know what? That is the small businesses. Those are, yes, wealthy individuals, but those are also small businesses. Those who employ 10, 12, 15 employees. That's going to be affected. Do you think the owner of that company is going to take a cut back in the income he makes? Of course not. It's his business. He deserves that income. So what's going to happen? He's going to turn around and he's either going to raise his prices, which is going to affect you, or he's going to lay off workers, which will also affect America. So here's the thing, guys. This health care plan, on the face of it, is too incredibly expensive to even think about, to even contemplate doing. You know, this news story talked about the 47 million Americans who are not covered by insurance. But here's the thing, guys. Did you know that of that 47 million, almost a little over half of those are just people who don't want insurance? They're younger Americans who are working who think they're bulletproof. So what the federal government is saying, we're smarter than you are. You don't want to buy insurance, so we're going to make you buy insurance. And if you don't buy insurance, we're going to penalize you. That House bill had provisions in there to penalize individuals if they choose not to buy health insurance. So I'm telling you, America, this is a power grab by the federal government in an incredible, incredible way. You need to contact your legislator. You need to contact your congressman, your senator. Go to senate.gov or house.gov and look up their name. Call them. Let them know this is ridiculous. You know, it's going to drive the cost of health care right through the roof. We're going to have health care like France and England, where you've got to wait for weeks and months to get health care for basic things we can walk into our doctor for right now and get health care for. Yes, we pay a little bit more for health care in this country. We pay a bit more, you bet. But you know what? I would rather pay more and get the health care when I needed it than to sit there and wait for weeks and weeks and weeks and weeks on end. People dying on waiting lists in these countries that have nationalized health care. Do we really want that? When you've got people from Canada coming to the United States to get health care, do we really want to put our health care system in the hands of the federal government? They have bankrupted Social Security. They're well on their way to bankrupting every program they've started. They're bankrupting us. Now Vice President Biden comes out and says, look, we can't afford not to spend. We can't afford not to spend money. We've got to spend money or we're going to go bankrupt. That was his headline. We've got to spend money to keep us from going bankrupt. Don't you love that? I mean, seriously, Don't you love that idea? You've got to spend money to keep from going bankrupt. And what they don't realize, they've been throwing billions and billions and trillions of dollars of our money down all kinds of rat holes. And guess what? We're still in trouble. So here's the thing. Bottom line is, we cannot afford this healthcare plan. We cannot afford the taxes it's going to throw on us as a country. We cannot afford the government to take over our healthcare system. They'll drive it right into the ground like they do every other doggone thing. So, Americans, call. We don't need the government in our healthcare. Call them. Let them know that. Let them know that we don't need their help.